Hey everybody, Dr. Schultz from the Centeno-Schultz Clinic with another weekly update. We're continuing our thoracic spine series, so thank you for checking in. Today we're going to be talking about referred pain from the thoracic spine ligaments. So again, thanks for checking in and let's get started. The goals of this short presentation are to identify what in the world is the thoracic spine, what exactly is referred pain, and what specifically are the referral patterns of the thoracic spine ligaments. So the thoracic spine is that section of the spine that's below the neck and above the lower lumbar spine. So it's in this area right here. Actually, some people talk about it as the mid-back. Now, the concept of referred pain is pain that is perceived in an area or location that's different than the actual site of tissue damage. The classic example is that of a heart attack. Even though the damage or the ischemia of the heart is occurring right here, patients may not have pain here, but have radiating arm pain or even jaw pain. This is a classic example of referred pain. Now, let's talk about what's a ligament. Basically, it's a piece of thick connective tissue that connects one bone with another. They're all throughout the body, and I've illustrated one here, and this is the ankle. There are many ligaments in the ankle, and you can see it just connects from one site to the next. It connects bone to bone. And what it does is it provides profound stability of that joint. So if you just think about ligaments as human duct tape that provide critical support, you'll be good to go. So what are the ligaments in the thoracic spine? Suffice it to say that there are a large number of ligaments in the thoracic spine, and I've actually done a presentation about that, but these include the radiant, the intercostal, which is depicted here, the lateral costal ligament, the superior costal ligament, the anterior longitudinal, the posterior longitudinal. But what we want to really talk about is the supra and interspinous ligament. And I want to take a deeper dive into those. So basically, in the middle of the spine, there are these pointy bones that I refer to as, they are actually called the spinous process, but I think of them as the dinosaur bone. You know, that really large bone right in the center of the spine that you can feel. And that's depicted here. This is a side view. This is an illustration of the spine. And this is the spinous process, otherwise known as the dinosaur bone. And connected between each of these spinous processes is a piece of thick connective tissue, otherwise known as a ligament. And there are two that I want to focus on here. The supraspinous, which is on the outside here, it connects each of the bones. Starts all the way in the cervical spine and extends all the way down into the low back and sacrum. And then in between this, a little bit deeper, is the interspinous. So basically some duct tape that connects the bone, the spinous process, at each level. And here's a better illustration. So this is the actual model of the thoracic spine in terms of orientation. This is where your head would be. This is where your tail would be. This is the front, otherwise known as anterior. And this is posterior. And again, here is that dinosaur, that spinous process that I talked about. And the supraspinous is this ligament that holds the tip of the spinous process. And then in the mid portion, there's the intra, not infra, sorry, that was a typo. I was thinking about the shoulder, that's interspinous ligament. So again, what is a referral pattern? A referral pattern is not this picture here. This is a diffuse image of thoracic pain. A referral pattern is a very specific pattern of pain or discomfort. It oftentimes, and more often than not, is different than the actual site of tissue injury or dysfunction. And what's interesting is at every level of the spine, it can be different. It can be unique. So let's look at the referral patterns of the supra and interspinous ligaments of the thoracic spine. So this is the front and this is the back. And you can see that, for example, this little area here, this very, very specific area, patient comes in and says, listen, I got this pain right here and it's been refractory to conservative care. You got to think, is this actually referred pain from the T2 ligament? Conversely, you can see this area of pain down here at T9 on the right. And you got to think, these patients are on the curb or on the sideline as a result of this pain, and nothing is helping. They're getting medicated, and it doesn't help. So you always got to think about referred pain in the thoracic spine, and there are lots of different sources. And today I wanted to highlight the supra and interspinous ligaments. At the Centeno-Schultz Clinic, we are experts in the evaluation and the treatment of thoracic spine injuries. We are all board certified, fellowship trained physicians. Has your doctor talked to you about possible thoracic spine ligament injuries being the cause of your pain? If not, give us a call if you continue to have pain and are being on the sideline and you're not able to do the things that you want. We offer an in-office evaluation or a virtual one. Thank you so much for checking in today. We learned about the referred pain patterns of the thoracic spine ligaments. Thank you again for your time. We'll see you next week.